Welcome to Elephant in the Room, a podcast featuring real conversations with real therapists on the elephant in every room, trauma. With this show, we are aiming to share insights from professional practitioners on trauma, its impacts, as well as various modalities and resources on healing for survivors. This podcast is produced by the Breaking Free Foundation, a Canadian registered charity that supports trauma survivors in reclaiming their lives and finding healing. All of the therapists interviewed on this podcast are members of the Breaking Free Foundation Trauma Practitioner Network. My name is Amber Craig. I am a trauma survivor, one of the co-founders of the Breaking Free Foundation, and the proud host of this podcast. Today we are joined by Cassandra Kleefman, registered provisional psychologist at Transcend Psychological in Edmonton, Alberta. Cassandra specializes in sexual assault, sexual health, sexual pain and dysfunction, infidelity, and other areas of sexual health. Please welcome to the podcast, Cassandra. Thank you for being here.
Thank you so much for having me. I'm so excited.
Me too. I'm very excited to dive into these topics, but first I want to give you an opportunity to sort of expand on your professional background and your areas of expertise.
Yeah, so interestingly, when I was in my undergrad, I actually wanted to specialize in forensics and go into forensic psychology. So I did a lot of research and volunteer work in the field of offending, which was super cool and a lot of fun to explore at that time. And then after I graduated from my undergrad, I started to transition more into just sexual health in general. And then I chose to specialize in the field of sexual pain and dysfunction specifically, just because there wasn't a lot of people who worked in that area. And I felt like it was something that, we really needed more specialization in. So I met my supervisor, Tammy Duncan, who has been specializing in that area for several years now. I don't want to age her or give it away, so I won't say the exact number of years, but a while. And we started working together, and I started learning under her and taking, extra courses on top of my master's, so that I could be prepared and ready to practice in this field.
That's amazing. I'm super excited to get into some things. It's kind of surprising to me that we have gone this many episodes without talking about these topics because it's literally how our foundation came to be. So I kind of just want to start with some of the areas that you work in, because I see that you have a certificate in intensive sex therapy, and I'm just curious what that is exactly.
So I don't know if you know this, but most master's programs for psychology or counseling don't actually offer a lot of education in sexual health. You will
Wow.
get usually one course that's pretty generalized. And I mean, of course, the topic of sexual health is so vast. So I can't even imagine trying to cover, a foundational groundwork in a course, but they definitely do try. And that's it. So if you're someone who wants to specialize as a psychologist or therapist in sexual health, you have to further your education outside of a master's program. So the intensive sex therapy certificate was done through the University of Guelph. And it really just dived into how to work with people around sexual health. Some of the go-to interventions that we might use, some of the assessment measures, how to do a sexual health assessment. Our society is still pretty hush hush and taboo and behind closed doors when it comes to sexual health. So they teach you how to approach those conversations and talk to people about their sexual health in a way that, makes it accessible. And then I also did the University of Alberta's Rehabilitation of Medicine's certificate in sexual health as well. So that's, again, just diving into further areas of sexual health that may otherwise not be talked about. So, inclusivity, learning how to engage with sexual health with all different kinds of diverse populations, um, treatment considerations, special topics, and that was part of my foundation. And then working under Tammy helped me further specialize in sexual pain specifically.
It's actually very surprising to me that sexual health would be a major component of psychology education, just because it's such a massive type of trauma that affects so many people. And I'm super surprised that that's not something that would be built into curriculum. So that's interesting. I didn't know that actually.
Yeah,
Um,
yeah, it's we definitely talk about trauma, and we have courses dedicated to trauma. Um, but what I have found to be quite interesting, just in my own work with clients, is they'll get referrals to me from other therapists who, I would think, I'm like, these aren't groundbreaking, topics that I feel they would even need to come and talk to me about. These are, just general sexual health concerns. Um, and it's unfortunate because I think if we had a little more training and education in that area, perhaps folks would feel a little bit more comfortable to address some of those issues and not feel like they have to send their clients to a specialized psychologist.
Yeah, I absolutely agree. Like as I mentioned earlier, our organization started from child sexual abuse specifically. That's kind of the first thing that we were sort of focusing on, and we certainly had a really hard time um, getting some awareness because we attached the word sex to what we were working on, which was challenging and interesting as well. Now we work in the broader terms of trauma, but certainly our roots came from childhood sexual abuse. So, since starting this foundation, we've had the opportunity to learn a lot about child sexual abuse. And I would say the first time I really heard about connections between child sexual abuse and medical issues was at a conference in Red Deer, actually, that Gabor Mate was at, which is amazing because now he's so
Okay.
famous. This was like many years ago, but he was really talking about the connection between, conditions like IBS or endometriosis, sexual pain, and all that, and child sexual abuse. So I would just love to get your take to expand a little bit more on what that linking looks like.
Yeah, yeah. So, I mean, first we need to understand how trauma works in our bodies, right? So, our bodies and the connection between our mind and our nervous system, is this network of muscles and neurons and how our brain is interpreting our experiences. So when we're exposed to a trauma, any kind of trauma, our brain takes that information and encodes it. So it's going to encode, exactly what your response was, what your emotions were, what you thought of that experience. If you've had prior experience with that trauma, or if it's a first time, it's going to bring that in as well. How other people around you are reacting to the scenario, and it takes all of this and it forms this bundle of trauma that it then chooses to save because our bodies and our minds are kind of hardwired for survival, right? So if this traumatic experience has occurred, our mind wants to remember that, our body wants to remember that to perhaps keep us safe if it happens again. So
Mm-hmm.
then if there is recurring trauma, not even recurring trauma, even if we're put into a similar scenario where there might be some what we call triggers, the body pulls up that bundle that it created. Our mind pulls up that bundle it created, and it starts to respond to that experience with what it's previously already stored. So, with sex specifically, if we've experienced any form of sexual trauma, our bodies are going to, in future sexual experiences, even if those experiences are consensual and we love this person and we're having a great time and they're fantastic, our bodies might still respond based on that sexual trauma if it hasn't been processed, or we haven't moved through that trauma in the way that we might need to in order to respond differently.
Yeah, that definitely makes sense. I think there's some really interesting, I mean, if anyone is curious, there's certainly a lot of research out there. Gabor Mate's books are a great resource
Mhm.
for specifically medical stuff. This kind of leads into my next question, sort of around sexual dysfunction and trauma. Like, what's your professional experience in seeing how trauma is impacting sexual dysfunction?
So I'll speak specifically to women for a moment, because something that I've noticed anecdotally and we see in the research is when we talk about sexual pain, um, it's one of the few pain experiences that is described within its disruption to functioning rather than the pain in and of itself, rather. So um, if we have a broken bone, we experience it, describe it, are treated for it as such. If we have sexual pain, it's treated within its disruption to our ability to have sex, which is just really
Right.
interesting. Um, because with that, I think comes a lot of cultural kind of connotations and maybe societal pressures or expectations or understandings that are influencing um, how we see that pain, right?
Right.
So for women especially, our center of gravity is right in that pelvic floor region. So we hold a lot of tension and functioning in that area because it's our center of gravity. Um, and for a lot of women, when they experience any form of trauma, physical activity, the way that we sleep, like everything kind of impacts those muscles, and it can lead to a lot of tightness in that area. But because we're not educated on our pelvic floors, like I didn't even know I had one until I was in university. I didn't know that
Right.
my pelvic floor existed as this beautiful connection of muscles and tissues and all these fun things till I was an adult. And so how up until that point, how much of my life did I spend not being aware of those muscles and that area of my body, to the point where, if I experienced a trauma or, some sort of injury, how is that impacting those muscles and the functioning of that area, right?
Yeah, I think it's like when you're describing it, I can imagine it's a very unique situation for people because if you just talk about sexual dysfunction or sexual pain, exactly what you're describing, like it could imply to the person that that involves the other person that they are having a sexual experience with, but truly it could be something living within themselves and they
Yeah,
have the power to fix that on their own without involving that other person at all because it could have just been, trauma stored from whatever that was. So it is really interesting to think about when you hear the word sex, you are automatically picturing the interaction of two people, but it could be an
mhm.
individual experience as well, for sure.
Absolutely. And I've had clients where their first sexual experiences did involve pain. And
Mm-hmm.
their very first experiences involving this pain. And but again, that's speaking to exactly that. Was there something that had happened prior? Did you have a physical injury even somewhere else in your body, and those
Right.
muscles in that region just reflexively tightened up? And because we're not connected to that part of our body in the way that I think we need to be, did you spend years with just tight, clenched muscles? And it was only until you started having sex did you realize that that pain even existed.
Yeah, absolutely. Um, One of the cool things about this podcast is that we get to sort of talk about different types of therapy that maybe people aren't familiar with, and that's why I was really excited to talk to you. Um, Again, you discuss on your website that you focus on sexual pain and dysfunction. So, for someone who has never thought about having a therapy experience that involves that, what does that look like? Is it the exact same type of therapy, but you're just speaking to that? Could you just walk listeners through what therapy looks like involving that lens?
Yeah, yeah. Oh, it's so funny because I I have had clients who have imagined therapy with someone who specializes in sexual health as almost like the late night Dr. Johnson like kind of experience.
Yeah,
And it's not that. I tell folks, you'll probably hear me say penis and vagina a lot more than maybe any other therapist you might work with. Um, but my foundation is still talk therapy, right?
right.
Um, and I do think that most people, especially in that first session, might feel a little bit awkward, a little bit uncomfortable. I do really try to bring in some humor, some levity into that first session, just to kind of make it more normal and more comfortable for folks. But my foundation is still talk therapy. So it doesn't look any different. Sure, it probably sounds a lot different than than normal therapy.
Right.
Um, but still, if you've had therapy before, it's probably gonna feel pretty similar. I'm just gonna, yeah, make you talk about vaginas and penises way more than maybe any other therapist.
Right. But it's a very normalized experience that would seem exactly you work in the same way that another therapist would that's not specializing in that.
Totally, totally. And I mean, I would say that perhaps a little bit more focused on like that psychoeducation piece. Like I really try to bring that in. I think knowledge can be so powerful when it comes to our sexual health, and especially if we haven't been given, um, a good education up until coming into therapy. I think that's a really important part of the foundation of my work. Um, and my homework it might look a little bit different too than what you might expect from another therapist. Of course, if we're talking about sex, um, probably going to be a lot more sexual activities that I'm going to be asking you to engage in, if we feel like that's the right sort of fit and suggestion for what's happening.
I think it's interesting, like you talked about education being critical, and I think that's even an opportunity in itself because to your earlier point, we don't get proper education around our own sexual health and our own bodies, when we're growing up. So to be an adult and still not understand so many parts of your sexual being, to just come into a therapeutic relationship with the lens of I would just like to better understand this, is a really cool opportunity for people as well, even if it's not something trauma based that they want to focus on. There's always something that could be uncovered, but I think just having the opportunity to work with someone who could better educate on different avenues is a cool opportunity as well.
Absolutely. And some of my clients, that is sometimes all they need is to just sit down in my office and hear me say like, hey, you're normal. Like this is normal. This is okay, right? Like what you are experiencing is just a part of the wonderful sort of expansive domain of sexual health that we exist in. And I'll get an email after that session being like, hey, I'm good. I don't think I need to come
Yeah.
back anymore, right? Or send them off with a book to read or a podcast to listen to. And um, I mean, when you think about it, it is a little kind of heartbreaking to see that sometimes that's all that people need.
Right.
And I don't think that they should have to pay me to give them that, like that should be something that's happening in our education systems when we're younger, and something that should feel more accessible maybe. But at the same time, I'm so incredibly honored to be able to give my clients that, and set them up for happy, healthy sex lives.
Yeah, I think it's you're exactly right. It's unfortunate that so many people don't have a safe space to have conversations that are just open and honest about sexual health, but it's nice that there is a place where someone could have a safe conversation if they don't have the ability to access that within their own community. It's just a cool opportunity for people.
Absolutely.
Um, I'm curious about, in your professional experience, how sexual trauma impacts relationships.
Mm. Well, you know, several ways. Um, the first one we kind of alluded to already, which is that if someone has trauma, and maybe not even just sexual trauma, but trauma in general, that impacts that pelvic floor region, they may not be aware of that impact until they start having sex with someone, right? So then it can come as this sort of shocking, what the heck is going on kind of experience for folks. Um, and I do find that for a lot of people, because we're so conditioned to believe in a certain way that sex is supposed to be. It's supposed to be penetrative. It's only supposed to be male, female. It's supposed to be, I don't know, missionary, and you're supposed to orgasm at the same, like all this bullshit that we learn from porn, that we learn from movies. We're kind of conditioned to believe that that is normal. That's our definition of normal. So if we have any experience with a partner or partners that deviates from this script, um, that becomes this internalized message of shame or embarrassment or guilt. And we might respond to that with anxiety, fear, right? We might shut down. And all of those things can have an impact on that relationship with that person, you know? And if we're not educated properly, our partner may perceive what's happening to us. If we're the one experiencing sexual pain, they may perceive it as they've done something wrong. Are there something wrong with them that's causing that to their partner, right? So the communication between partners, if it's not already established, can really, really be hindered because we don't talk about sex. We have sex, but we don't talk about sex.
Right.
So if there's something going on that's deviating from the script, and we're not talking about it, that can create a lot of distance between partners. That can create a lot of maybe even resentment, or anger, frustration, disappointment, right?
Yeah, I want to stick on that theme for a second. So, if, like, speaking to partners of those who have been through sexual trauma, for an example, if you do have some level of communication with your partner and your partner has told you that they have had sexual trauma, how can someone show up in a safe and supportive way for their partner who's a survivor of sexual trauma in order to have a safe sexual relationship with them? Are there tips that you would give a partner of somebody?
Yeah, so it's great to have that communication already established. And I would say that we really want to make sure that communication does feel safe and we're able to maintain that in an ongoing way. Because especially with sexual trauma, sometimes we don't know how we're going to respond in different scenarios. We don't know, what certain triggers might be for us. So it's really important to have that foundation in that space to be able to say to our partner, hey, like I'm not okay right now, or something's happening, or I need us to stop, or whatever. So for the partner in that scenario, it's being open to that kind of feedback and learning how to take that feedback in the way that your partner needs. um, you know, and that's partner to partner, right? So some folks might need the caring sort of response. Some folks might need their partner to crack a joke. Some folks might need their partner to create physical distance, right? It truly just does depend on what's going to help that partner feel safe in that moment. So safety and communicating safety and giving safety is so important. We also want to be working on, disappointment management and expectation management too, right? I sound like a broken record to my clients with this, but I frequently tell them, pressure and expectation don't belong in your sex life. Those are really, really harmful, really toxic things to have. And it can really prevent closeness and connection and pleasure from, being there. So we really want to work on managing some of those feelings. We don't want to say, you're not allowed to be disappointed or you're not allowed to be upset. Those are, of course, valid feelings to have, but you don't get to translate that into pressure and expectation on your partner to push through their trauma responses in order to satisfy your, sexual desires in that moment.
That's really, really well said. Communication keeps coming up, so I feel like it'll be a good theme for today.
Yeah. Yeah.
um, Another area I kind of want to get into with you is sex addiction. It's something that actually comes up a lot in our monthly support meetings because we work with all types of trauma. Um, we see a lot of different types of addicts coming to our meetings. And like anything with the word sex in it, there's so much stigma and misunderstanding around what sex addiction is. So, because I'm talking to a professional in this field, I would love to know what your definition of sex addiction looks like.
So there's like a couple caveats with this. So the first caveat is my definition of what sex is and what it means. So sex to me is an experience that we utilize to fulfill deeper needs that we might have. So whether those needs are a need to be desired, a need for connection, a need for safety, a need for emotional support, a need for stress relief, right? It's fulfilling something for us that's happening on a deeper level. And that fulfillment can be healthy and adaptive, or it can be unhealthy or maladaptive. And when we get into the maladaptive realm, I think that's where a lot of folks start to identify with sex addiction, right? I do have some, call it, issue with terminology like sex addiction, simply because is it that you're addicted to sex, or is it that you're addicted to whatever need sex is fulfilling, and sex is just the tool that you're utilizing to fulfill that need, right? And I mean, the argument for that could be made with any form of addiction. But I know working with a lot of clients, even just saying it in that way can help to erase some of that stigma, letting them know, hey, having something like a sex addiction, like this is truthfully your way of fulfilling some sort of deeper need that you might have. So let's unpack that. Let's figure that out. Let's find other adaptive ways of fulfilling that need so that, sex doesn't have to be the way that you choose to fulfill that. And for a lot of folks, that sex addiction can manifest through porn addiction. Porn addiction, operates very similarly to other substance addictions, meaning it works on the same sort of dopaminergic pathways in the brain as something like alcohol or cocaine does. And so with any addiction, sex or porn, I do treat it very similarly to other forms of addiction, with trigger management, with changing the coping strategies from maladaptive to more adaptive ones. But, truthfully, I do think that it's just one of the ways that people can get caught up in trying to fulfill a need that otherwise hasn't been fulfilled in a meaningful way for them.
Yeah, you said a lot of really interesting things there. I was taking notes because I wanted to circle back, but I really like how you clarified addiction in general, and I think it's worth repeating because it's come up before in other conversations on this podcast that it's really not the title that's important, it's the validation of how somebody feels, and that can have a lot of different names if you want to name it, but I think that was a really good point that, understanding what's causing the behavior and validating that that's legitimate is
Mhm.
oftentimes a lot more important than someone getting the title of I'm an addict and this is what I'm addicted to. That's not really the goal of that. So I thought that was
Mhm.
a really good point to just clarify.
Yeah, it's I mean, some of my clients who have presented with sex addiction do really take that name and they like to own it, and it gives them a sense of kind of power over it, which I think is fantastic. But other folks, that title and that wording is a large part of their shame, and we do want to move away from that because the title doesn't matter. Whether you want to say that you have a sex addiction or that you've been fulfilling your need for love through sex, like it doesn't matter as long as we are getting to that root and supporting that need in transitioning from maladaptive to adaptive.
Yeah, absolutely. Um, do you think there's any misconceptions around sexual trauma that you think should be addressed?
I would say one of the biggest ones is that um, sexual trauma only manifests in sexual experiences. So if we have sexual trauma, it's only going to show up, when we're having sex. And that could not be further from the truth. You know, um, Sex is a facet of our lives. It is an aspect of it. But of course, it's not the entirety of our identity, and it is connected to so many other bits of our life as well. So when we have trauma in that area, um, it's silly to think that it would only affect that area. And I imagine that comes from, the still present societal, idea that sex is behind closed doors, it's taboo, it's, something we don't talk about. It doesn't kind of just sits over there in a box away from everything else. And that's just simply not the case. So clients who have experienced sexual trauma do see impacts in other aspects of their lives, whether that's with their romantic partners, in their friendships, at work, at school, right? Like uh, it's definitely not just isolated and only impacting that one area.
Yeah, that's a really, really good point, actually. Um, what is your favorite part of your job?
I would say, what is my favorite part? I mean, truthfully, like I love all of it. It's so hard to pick one part. I think it's really cool what I get to do. I love that I get to support folks with their sexual health, um, especially because it's not something that's talked about as openly and freely. So it's an incredible honor when someone takes that step of courage to reach out and work with me. So that definitely is one of my favorite things, is just knowing that I can help people in that area. Um, and I would say watching my clients progress towards their therapeutic goal, whatever they've identified that is such a cool experience. And seeing how when they step into like owning their sexual pleasure and owning their sex lives in a way that they want to, how that actually impacts the rest of their life as well. It's really cool to see.
That is awesome. What would you say is the hardest part of your job?
Oof. I would say working with sexual pain specifically, because it's not talked about, because it's still met with a lot of um, stigma. I mean, even in the medical field, I've had countless clients tell me that doctors have told them to just have a drink and try to relax, or the pain's in their head and it's not real. Um, so seeing their isolation and that feeling that they express of just loneliness and hopelessness sometimes is truly the hardest part of my job. Because I truthfully don't think it has to be that way. And if there was more education around it, I don't think that it would get to that point. I truly don't. I'm not saying that sexual pain would disappear, but that folks wouldn't feel as isolated and alone in their sexual pain as they really often do. So when a client comes in and those are the feelings they express, like it breaks my heart.
Absolutely, I can see that. Um, I ask everyone this question on the podcast, but do you have any favorite trauma resources that you like to recommend?
I actually read a fantastic book last, what was it? I think it was in October. It's called, I have it here. It's called What My
I'm reading it right
It's
now.
so good. So good.
Oh,
Um,
amazing.
I think she's a fantastic just writer in general. She writes in such a way that is just a page turner. And she presents complex trauma, complex PTSD in such an accessible way. Truthfully, that is one of my favorites. I know everyone loves like how the body keeps the score, but I do just find that that one reads, so like medically, and it's very terminology intense, and it's not as accessible for all readers. So when I found this and I read this, I was like, oh my God, yes, this is amazing. Um, and then for sexual trauma, there's not a lot of books that specifically address sexual trauma. But one of the kind of pillars of great books is Come As You Are by Emily Nagoski. That is this book right here. I don't know why all sex books have to be pink, but they are.
Yes.
They're all pink. But that one's really good in the sense that it normalizes a lot of sexual experiences. It does talk a little bit about trauma, um, but it normalizes just a lot of what we would maybe think is abnormal sexual experiences. Um, Provides fantastic education and some really great tools for managing experiences.
Yeah, and in case anyone isn't watching the video, I got way too excited when you showed the first book. It's called What My Bones Know.
Yes.
I totally interrupted you when you were saying that because I just started reading that book and it's so good so far.
Yeah, no, she did a phenomenal job with that one. I was in tears, and I'm like, I was shocked. I think I was sitting on a train traveling, and I'm like crying into this book as I'm reading it.
Oh man.
And my partner looks over, he's like, what is going on? Are you okay? Like, happening? This is just so good.
Yeah, that kind of thing doesn't turn me off at all. I'm like very excited about getting into it. So I'm glad you brought it up. It hasn't been brought up before on the podcast. This has been an amazing conversation. Is there anything else you would like to share before we close?
Um, I don't think so. I would just say that um, for the folks that are listening, you are the expert in your own life, and listen to your body when it is telling you something. It's not telling you that for no reason. So pay attention. Seek that professional support if you need it. Um, because our bodies are just amazing at telling us what they need if we discover how to listen properly.
Very well said. And you mentioned, the courage that your clients have for reaching out and wanting to discuss something that is stigmatized. But I also want to just commend you for agreeing to do this podcast because even though there's a lot of professionals in this space, it's still not that easy to find people who are willing to talk publicly about it. And I was just really honored that you decided to have this conversation. So thank you so much for being on the podcast today.
Yeah, thank you so much for having me, Amber. It's been fantastic, and I'm so happy to be able to talk about this.
Awesome. So if anyone is looking for more information about Cassandra and her practice, you can see our show notes. The Breaking Free Foundation offers therapy grants for trauma survivors in Alberta, and we also host 2 free support meetings a month. One is in person in Calgary, and one is online. For more information on trauma therapy and our organization, please visit us online at breakingfreefoundation.ca. If you enjoyed this podcast, please subscribe and share. That's all for now. Stay well.